Hello, and thank you for joining us for today's webinar. This webinar is brought to you by Kamedis, bio-herbal skincare, and we are very happy to have Michael Traub with us as our presenter today, and he will be speaking on the science behind nature, the philosophy and approach to treating topical skin conditions with herbal extracts. So with that, I'll go ahead and turn the time over to Dr. Traub, and thank you for being with us.
Hello, this is Michael Traub. I am a naturopathic physician and the chair of the Naturopathic Scientific Advisory Board for Kamedis, and thank you for joining us this morning. So we are going to go ahead and get started here, and just trying to advance my first slide. There we go. Okay, so Kamedis is a unique dermatological company that for the last 15 years has conducted research and development on skincare products containing botanical extracts that have been proven efficacious in clinical studies. Many botanical-based topical products on the market are not based on research. If they are, the herbs are not generally in a high concentration. Kamedis has developed a patented process with stringent quality control procedures for concentrating herbal extracts so that they have high biological activity. The result are tropical preparations that resolve the underlying disorder in the skin without having to rely on corticosteroids or other compounds that have a significant side effect profile. The idea that skin diseases are a reflection of an internal disorder is a bit of an antiquated idea in naturopathic medicine. As we will see, the primary causative factors for skin diseases frequently take place directly in the skin itself, not elsewhere. So from a naturopathic perspective, there is an inside-out approach to skin diseases as well as an outside-in. And today we're going to be talking about the outside-in, the application of topical products to skin diseases. So Kamedis has developed 4 lines of skincare products that can complement a comprehensive approach to skin conditions, such as atopic dermatitis, acne, seborrheic dermatitis, and psoriasis. Kamedis is the product that has been developed for itchy, dry, sensitive, inflamed skin, such as we see in atopic dermatitis. Kamedis is for oily, blemish-prone skin, such as in acne. Kamedis is for red, dry, scaly skin and scalp, such as in psoriasis. And Kamedis is for red, oily-prone facial skin and dandruff-prone scalp, such as in seborrheic dermatitis. Kamedis has conducted R&D primarily on herbs that have been used for over 2,000 years in traditional Chinese medicine. The herbs are grown and processed on a large facility in Mongolia. The potential adverse effects of pharmaceutical topical drugs are well known. Topical corticosteroids are not curative for atopic dermatitis and psoriasis, and they can result in growth retardation in children if used in large doses over long periods of time. Topical antibiotics applied for acne can foster the development of resistant strains of bacteria. So people want a natural, safe, and effective alternative to such treatments, and this is provided by the products that Kamedis has researched and developed and proven. This diagram illustrates the pathogenesis seen in inflammatory skin conditions, such as atopic dermatitis and psoriasis, both of which are characterized by distinctive genetic abnormalities. So as we see on the top left of the slide, in the case of atopic dermatitis, there's a mutation in the gene that codes for the production of filaggrin, a protein in the skin that's responsible for maintaining its barrier function and the prevention of transepidermal water loss. A defective barrier results in the secretion of pro-inflammatory cytokines in the epidermis and the entry of allergens and pathogens through the stratum corneum that activate dendritic cells, as we see under the large orange arrow on the top of the slide. The D in the epidermis there are dendritic cells that lead to further activation of both T lymphocytes and B lymphocytes in the dermis below. This inflammation causes a further decrease in ceramides, which are compounds in the skin responsible for maintaining its water content, filaggrin, and antimicrobial peptides, resulting in more damage to the barrier, more pro-inflammatory cytokine production, pruritus, and scratching, as you can see with the fingertip on the top of the slide. And the scratching further damages the skin barrier, again granting more access to allergens and pathogens that complicate the disease process. So the scientists at Kamedis have screened thousands of plants over the past 15 years, selecting those most potent in helping to address the pathological mechanisms of skin diseases. Kamedis has a patented extraction process to optimize the concentration and biological activity of herbal extracts. With the use of Kamedis' patented macroporous resin chromatography, the extraction process increases the concentration of biologically active constituents, as well as removing unwanted ones, resulting in better stability of the final extract, as can be seen on this slide. This process results in standardization of selected extracts that are then used in formulas for specific conditions. As an example, the percentage of the active constituents of rheum palmatum, aloe, emodin, rain, and emodin, they're increased from 5% to 20% in the extraction process using macroporous resin chromatography. The high concentration of these constituents then results in significantly enhanced inhibition of the secretion of pro-inflammatory cytokines. Let's take a look at how this science can be applied to atopic dermatitis. Atopic dermatitis begins in childhood, 10 to 30% of the time, and its prevalence has been significantly increasing over the last 30 years. Conventional treatments for atopic dermatitis control the severity and duration of the condition, but they fail to cure it. Most of these treatments frequently come with a price of adverse effects. Kamedis is the product line Kamedis has developed that can be very helpful in clearing atopic dermatitis. Kamedis body cream contains concentrated extracts of 4 herbs: rheum palmatum, Scutellaria bicalensis, Cnidium monieri, and a derivative of licorice root called dipotassium glycyrrhizinate. Licorice root has been used in topical skin products for many years. In a study conducted in 1958 and published in the British Journal of Clinical Practice, 9 of 12 patients with intractable eczema noted marked improvement, and 2 noted mild improvement when an ointment containing glycyrrhetinic acid was applied topically. In another study, 93% of the patients with eczema applying glycyrrhetinic acid demonstrated improvement, compared with 83% using cortisone. So, for many centuries, the rhizome of rhubarb was highly regarded by the Chinese for its various medicinal properties, and later on modern research has justified its reputation. Here's 10 references to studies conducted on rhubarb from 1987 to 2007. In vitro studies of rheum palmatum 3% extract have shown greater anti-inflammatory activity than corticosteroids in measures of prostaglandin E2, interleukin-1 alpha, and interleukin-13. And the antioxidant activity of even 1% rhubarb is equivalent to that of 10% extract. Now let's take a look at some of the clinical data for topic Kamedis. The Kamedis line, which can be used for a condition such as atopic dermatitis, is called Topic Kamedis and includes a cleanser, a body cream, a face cream, a calming moisturizer, and a rich hydrating gel, all of which are hypoallergenic, clinically tested, and free of fragrances, steroids, parabens, and sodium lauryl sulfate. They can safely be used for children as young as 6 months of age. Topic Kamedis Body Cream is designed to increase the hydration of the skin's barrier and relieve itching. A clinical study of Topic Kamedis Body Cream in 20 patients with atopic dermatitis applied twice daily over 3 weeks showed statistically significant reduction of 48% in the itching level. It also yielded a 29% improvement of moisture level in the skin versus untreated controls. Now this is only in 3 weeks, and continued use will obviously provide greater results. In this study, there were no adverse events observed. There was a significant improvement shown in symptoms. No patients required additional corticosteroid treatments. No cases of worsening were recorded, and no bacterial secondary infections were observed. Let's move on to psoriasis now. Psoriasis is a chronic immune-mediated inflammatory disease that's partly genetically determined and partly dependent on environmental triggers to trigger the genes or to trigger their expression, and it's characterized by scaly patches and plaques on the skin. As with atopic dermatitis, conventional treatments for psoriasis don't cure the disorder, and most treatments cause side effects when used for long periods of time. The Kamedis products used for psoriasis are called Kamedis and consist of the following herbal extracts: Indigo tinctoria, Rheum palmatum, Portulaca oleracea, Philodendron amurensa, Angelica sinensis, Sapindus mucorosi, and Ti-potassium glycyrrhizonate. Indigo tinctoria has several biological activities that make it an effective treatment for psoriasis, including modulating the proliferation and differentiation of skin cells, that's the primary defect in psoriasis, and inhibiting T lymphocyte infiltration and pro-inflammatory cytokines. A clinical trial of indigo ointment versus vehicle applied daily for 8 weeks in 14 patients with treatment-resistant psoriasis showed significant improvement in clinical scores of psoriasis as well as in skin histology. Proliferation and inflammation were decreased, and filaggrin was increased. These figures show the changes in mean clinical scores in the study. These photos show the reduction in scaling and area involved. The Kamedis product line consists of a body cream, a shampoo, and scalp lotion. The Kamedis body cream is highly moisturizing, paraben-free, and safe to use in children 3 years of age and older. The Psoriasis Area and Severity Index, or PASI score, is used to assess response to treatment in psoriasis. In this 6-week trial of Kamedis body cream in 20 patients with psoriasis, there was a reduction of scaling in 100% of subjects, and 58% reduction in severity, and 82% reduction in itching. Kamedis shampoo and scalp lotion can be used to relieve the scaling in scalp psoriasis and in seborrheic dermatitis 2 to 3 times a week. A 6-week trial of 21 patients with scalp psoriasis who used Kamedis scalp lotion and shampoo found a highly significant 92% reduction of the severity of scaling and 83% reduction of itching. This is a very impressive treatment response. So let's look at how Kamedis stands up to conventional competing treatments. This is a table that compares Kamedis body cream with other published trials of conventional topical treatments for psoriasis. PASI 75 is regarded as the clinical benchmark for efficacy in clinical trials of treatment for psoriasis. The top of this table shows the improvement in PASI 75 after 8 weeks for calcipotriol and betamethasone. Betamethasone is a potent corticosteroid. Calcipotriol is a vitamin D derivative. This combination is the most effective conventional topical treatment for psoriasis, and it provides a PASI 75 of 32.2% reduction and a reduction in severity of 57%. Now compare this to the Kamedis body cream at the bottom of the slide, which showed a superior improvement after 6 weeks of 50% in PASI 75 and a comparable reduction of severity in 58% of patients. This table compares Kamedis body cream to results of trials of 3 biological agents used for psoriasis, again showing a favorable comparison in PASI 75 and reduction in severity. As you can see, the duration of treatment for the biological agents were 12 weeks, whereas the trial for body cream excuse me, is only 6 weeks, but provides a very comparable change in PASI 75 and efficacy. And the biological treatments are typically administered by injection, whereas these systemic injectable treatments are being compared here to a topical agent. So in conclusion, there's clinical data which confirms the comparable efficacy of the Kamedis product line as a natural alternative to comparable treatments with a better safety profile. So if any of you would like to discuss this or have any questions for me, please write them on the panel on your screen under questions or chat, and I will be happy to address any questions or comments that you may have. Thank you.
Thank you very much, Dr. Traub. And if anybody does have any questions after the webinar is completed, you can also send them to info@kamedis-usa.com, which you can see at the bottom of the screen that is in front of you. So if you do have any questions now, please feel free to ask. If you have any later, you can always email us. We will also be providing this webinar online in the next few days, and we'll make sure that you each have a link to that so that you can view it again or share it if you desire. Thank you very much for participating, and thank you very much, Dr. Traub, for presenting.
Thank you.
So Dr. Traub, one question is, any concerns combining topical Kamedis with UV light therapy?
That's a good question. I'm not aware of any concerns. The answer would be in terms of whether any of the herbal extracts have a photosensitizing effect that might enhance the UV therapy or increase the risk of overexposure to ultraviolet light. And as I say, I don't know the answer to that, but it's certainly something that we can check into and get back with that answer to the questioner.
Fantastic. Another question comes that says, do you have a personal favorite product for non-specific dermatitis?
Well, non-specific dermatitis is not really a diagnosis. It's a it's a term that means that a diagnosis has not been reached, and I think that the Kamedis body lotion would be a great thing to use in a case where the diagnosis had not been made. While continuing to search for a diagnosis, the thing that is typically done by dermatologists when a diagnosis of atopic dermatitis or contact dermatitis is not obvious and not made easily is to do a biopsy and to look at the histology under the microscope to see if there are any clues to other forms of dermatitis that might be causing the lesions. But I can see of no contraindications to using the Kamedis body cream while searching for a more accurate diagnosis of a dermatitis that has not been diagnosed yet.
Right now, so thank you everybody for participating. Thank you again, Dr. Traub. And again, if you have any questions or would like more information about anything from the webinar or from Kamedis, we are happy to provide. Please email info@kamedis-usa.com. Thank you again, everybody, and have a wonderful day.
Thank you.